So very good morning, good afternoon, good evening everyone. Today we are going to discuss another topic under Unit 1 Cardiovascular Pharmacology, that is your anti-arrhythmic agents. Anti-arrhythmic drugs. So the drugs which are used in the management of arrhythmia, that drugs we called anti-arrhythmic drugs. So what is arrhythmia? So you knows in earlier video also we have discussed there is a rhythms, there is a action potentials in the heart, and there is a ventricle contractions, repolarizations, and then there is a again depolarizations and relaxation is there. So how it happens, how the conductions in the heart is happens. If you remember, we have discussed there is a different phases. It's like this is the zero phase, this is the first phase, this is the second phase, this is the third phase, and then there is a fourth phase. So zero phase, you all knows resting membrane potential of this cell, particular cardiac cell, is your minus 90 millivolt. Whenever there is any stimulus, so what happens, there is a movement of ions from extracellular fluid to intracellular fluid. So in this case, in zero phase, what happens, your sodium channels open, then there is a movement of sodium from outside the cells to inside the cells, and due to that your action potentials, which is in minus 90 MeV, it will becomes less negative, and when your action potential reach to threshold values, then there is a more voltage gated sensitive sodium channels or calcium channel open. So there is a movement of more positive charge from outside to inside, so your action potential will goes towards positive sides. This is the positive sides, right, and this is the negative sides. So it goes towards the positive sides, and here up to this points your sodium channel is going to close, and in phase 1 what happens, there is another channel which is open, is potassium channels. So potassium is open, and earlier also we have discussed, whenever potassium open, so your action potential is going to decrease even though potassium contains a positive charge. Why it is so? Because potassiums, whenever channel opens, so there is a movement of potassium from inside the cells to outside the cells, right? So ultimately your cells will become so less negative. So what happens whenever potassium channel opens? So potassiums will go from inside to outside. When sodium channel opens, sodium movement will happen from outside to inside. Why it is so? Because potassium concentrations inside the cell is more, and sodium concentration outside the cells, this is your extracellular fluid, is more. So the questions many times asked, potassium is also the positive charge, sodium is also the positive charge. So when sodium open, your action potential goes towards positive sides, right? But when potassium open, your action potential goes downside. Why it is so? The reason is because when sodium open, sodium movement will happen from outside to inside, and when potassium open, potassium movement will happen from inside to outside. So ultimately when potassium opens, these will become less positive. So this happen in the phase 1. Phase 1, what's happening? Potassium channel potassium channel open and sodium channel close. So due to that, there is a little bit dip in the action potential, right? Then after that, in phase 2, you can see that your action potential will become stable for a small period of time, and this phase we also called phase 2, we also called plateau phase. Plateau phase means it's a stable. For some time your action potential will become stable, right? The reason is why it's stable, because potassiums will, first phase, second phase, third phase, in every phase potassium is open, potassium is not closing, whether it is phase 1, phase 2 or phase 3. In phase 1, 2, 3 potassium is still open, but in phase 2 what happened, another channel open, that is your calcium channels. So these calcium channels will make the balance, because calcium will move from outside to inside and potassium is moving from inside to outside. So it makes the action potential stable for small period of time. So that's why we also call it a plateau phase. Then what happens after the end of this phase, here your calcium channel close. But as I said, in each phase 1, 2, 3, who is open? Potassium channels. So now calcium channel close, which maintain the action potential for smaller period of time. Now your potassium channel open, so your action potential is dropped down, right? It goes towards the less positive. So it goes down, that is your phase 3. So this is the action potential, how electrophysiology of heart is working, and particularly we are talking about anti-arrhythmic drugs. So you know, if you see the cell membrane, so what happens? First, sodium channel open, we have discussed it many times, sodium channel open, right? Then there is a calcium channel is also open, so there is a movement of calcium as well, and these calciums have a storehouse, smooth endoplasmic reticulum. It's going to activate and release more calcium. Calcium is going to bind with tropomycins, if you remember, and tropomycins, when calcium interact with tropomycins, actin and myosin filaments will interact with each other, and it results in ventricular contractions. So how ventricular relaxation happen? In ventricular relaxation, the sodium should go outside the cells because sodium is responsible for depolarization. So there is a sodium calcium exchanger, sodium will go outside, right? Sorry, not sodium, calcium sodium exchanger. So first calcium, whatever the extra calcium, it will store inside the smooth endoplasmic reticulum. This extra calcium will go outside with the help of sodium calcium exchanger. So in this exchanger, calcium will go from inside to outside and sodium will come. So now which ion is extra inside the cell? Sodium ion. So who will correct this? There is a sodium potassium pump. So due to that pump, 3 sodium will go outside and 2 potassium will come inside, right? So it will become, your cell will relax, right? Again I am telling, this is the electrophysiology of your heart, and whenever there is any, you know, action potentials become negative or become positive, it can result in bradyarrhythmia or tachyarrhythmia. Tachyarrhythmia means if your ventricle is contracting fast, that could result in tachyarrhythmia. If it going to slow down, then it could result in bradyarrhythmia. So arrhythmia can be of 2 types, tachyarrhythmias or bradyarrhythmia mainly. So bradyarrhythmia means decrease and tachyarrhythmia means increase in the rhythm, right? So what is the rhythm? Rhythm is, this is the electrophysiology. So if I explain in Hindi, so electrophysiology हमने पहले भी पढ़ी थी, resting membrane potential कार्डिक सेल का -90 मिलीवोल्ट है. फेस 1 में क्या हो रहा है? सोडियम चैनल ओपन हो रहे हैं, सोडियम चैनल ओपन हो रहे हैं तो सोडियम मूव कर रहा है आउटसाइड टू इनसाइड, उससे एक्शन पोटेंशियल्स लेस नेगेटिव. जब थ्रेशोल्ड पे पहुंच रहा है तो और कैटाइन वोल्टेज गेटेड सेंसिटिव, सोडियम चैनल ओपन हो रहे हैं, एक्शन पोटेंशियल और ऊपर की तरफ जा रहा है. यहाँ फेस 1 में क्या हो रहा है? सोडियम चैनल क्लोज हो जा रहे हैं और पोटासियम चैनल ओपन हो रहे हैं. आपको ये याद रखना है, फर्स्ट, सेकंड और थर्ड फेज तीनों में पोटासियम ओपन ही रहेगा, पोटासियम चैनल ओपन ही रहेगा, राइट? सो पोटासियम चैनल ओपन हो रहा है तो क्या हो रहा है? लिटिल बिट डिप कर रहा है आपका एक्शन पोटेंशियल, दैट इज योर फेस 1. जब फिर यहाँ पे क्या हो रहा है? पोटासियम तो ओपन ही रहेगा तीनों फेस में, पर साथ में यहाँ पे क्या हो रहा है? इस फेस में कैल्शियम ओपन हो रहा है, तो कैल्शियम अंदर से बाहर जा रहा है, सॉरी बाहर से अंदर आ रहा है कैल्शियम, और पोटासियम जो है वो अंदर से बाहर जा रहा है. तो ये दोनों को बैलेंस कर देता है फॉर वेरी लेस टाइम. तो उस केस में आपका ये स्टेबल हो जाता है, राइट? सो दैट इज बी ऑल्सो कॉल्ड प्लेट्यू फेज. फिर यहाँ पे क्या हो रहा है? कैल्शियम क्लोज हो जा रहा है. अब इसको बैलेंस करने के लिए कोई आयन बाहर से अंदर नहीं आ रहा है पॉजिटिव, और पोटासियम तो ओपन ही रह रहा है, तो पोटासियम ओपन है तो ये आपका एक्शन पोटेंशियल ड्रॉप डाउन करेगा. तो पोटासियम इज रिस्पॉन्सिबल फॉर रीपोलराइजेशन, राइट? इफ यू रिमेंबर रीपोलराइजेशन कि वेंट्रिकल आपके कॉन्ट्रैक्ट किए, कॉन्ट्रैक्ट करने के बाद वेंट्रिकल्स को रिलैक्स भी करना है, राइट? तो वेंट्रिकल कॉन्ट्रैक्ट किए, दिस इज द फेज. कॉन्ट्रैक्ट कब किए? दैट इज डीपोलराइजेशन. जब पॉजिटिव आयन सेल्स के अंदर आए बाहर से, तब आपके वेंट्रिकल कॉन्ट्रैक्ट किए. अब कॉन्ट्रैक्ट के बाद वेंट्रिकल्स को रिलैक्स भी करना है, तो रिलैक्सेशन के लिए कौन सा आयन रिस्पॉन्सिबल है? पोटासियम आयन. पोटासियम आयन इज रिस्पॉन्सिबल फॉर repolarizations or relaxation of ventricle. So there is a depolarization and repolarization. If you see in the ECG, so there is a, you know, P, Q, R, S, T interval, right? This is P wave represent atrial depolarizations, QRS represent ventricle depolarizations, T wave represent ventricle repolarization. So if I am calculating this QT interval, QT, यहाँ से यहाँ तक का अगर मैं इंटरवल, दिस इज द QT interval, right? So what the QT interval representing? QT interval is representing your ventricular depolarizations and ventricular repolarizations, right? So this whole phenomena in ECG, you will get ventricular depolarizations and then repolarizations. So this is a repolarization, this is your depolarizations, right? So, and as I said, how it's happening, we have earlier also discussed. Okay. So what happening on the ion channels? So as I said, sodium is opening first, sodium move, action potential goes, reach to the threshold values, then there is a calcium also comes in, right, and it will activate your smooth endoplasmic reticulums, more calcium will bind with protein, that is called modulin, and when this complex is going to interact the actin and myosin filaments, and when actin and myosin filament interact with each other, it result in contractions of the ventricles, right? So this is the ventricular contraction which is represented by QRS complex in the, this you will get QRS complex in the ECG, right? Now what is next? Next is your ventricle which are contracting, it has to be relaxed as well. So how relaxation happening? So for relaxation what is required? You have to be expel the positive charge from inside to outside, then only your cell will relax, right? तो पॉजिटिव चार्ज कौन सा है? एक तो कैल्शियम है, तो कैल्शियम को आपको बाहर भेजना पड़ेगा, तो बाहर भेजने के लिए देयर इज ए पंप which pump out the calcium, but with this pump sodium will also comes in, so this we call sodium calcium exchanger. तो calcium, whatever the calcium extra, it will store in smooth endoplasmic reticulum, यहाँ पे कुछ बच गया वो इस पंप के द्वारा आपका अंदर से बाहर चला जाएगा. बट अब और कौन सा आयन रह गया अंदर जिसकी वजह से डीपोलराइज अभी भी सेल कॉन्ट्रैक्शन फेज में? योर पॉजिटिव चार्ज आयन सोडियम. सो सोडियम हैज टू बी ऑल्सो एक्सपेल फ्रॉम द सेल्स. तो सोडियम के लिए आपका वेल नोन पंप है सोडियम पोटासियम पंप, 3 सोडियम बाहर 2 पोटासियम अंदर, राइट? दिस इज सोडियम पोटासियम पंप जो कि आपके सेल, हर एक सेल्स की मेम्ब्रेन के ऊपर है, वो सोडियम को एक्सपेल करेगा बाहर. So these all you can absorb in the ECG as well. So we are talking about arrhythmia. So now this is the electrophysiology, and then arrhythmia. Anti-arrhythmic drugs are those drugs which will correct the rhythms, right? So if you talk about anti-arrhythmic drugs, so there is a, class 1 drugs, class 2, class 3, 4 and class 5. There are 5 classes, and this classification we also call Von-Willebrand classifications, right? So that scientists have classified these anti-arrhythmic agents. So class 1 are those agents which are sodium channel blocker, mainly. That comes under class 1 drugs. Class 2 drugs are beta blockers. We are using the beta blockers particularly in the tachyarrhythmia. जब आपका tachyarrhythmia हो रहा है, we are using the beta blocker to slow down the heart. Class 3 agents are your potassium channel blockers. And class 4 agents is your calcium channel blockers. And class 5 are those agents which does not comes under these category, that we call miscellaneous agents. जिनके mechanism इन चारों में से नहीं fall करते. So these are the 4 types of drugs which we are using in the treatment of arrhythmia or in the management of arrhythmia. So one by one we are going to discuss. We are going to discuss class 1 agent, class 2, class 3, 4, 5. First you have to understand, if we are giving these type of drugs, what will be the effect on the electrophysiology, right? If you are giving the patients class 1 agents, then what will happen? I told you, this is your electrophysiology, this and little bit dip, then stable, then down. This is the 0 phase, 1, 2 and 3. So if you are giving the patients class 1 agents, what do you think? This 0 phase is going, this slope will go this side or this side, right? You are blocking the sodium channel, right? So the slope of phase 0 is going to decrease. So if you are giving the patients class 1 drugs, that is a sodium channel blocker, so you will find like this. Rest will be same, but this slope is going to shift this side, right? If you are giving class 1 agents to the patients, right? If you are giving potassium channel blockers, so potassium channel blockers, you know that potassium is working here in the phase 3, right? If you are blocking potassium channels, so it will go towards this side, phase 3, or this side. It will prolong or it will decrease the duration. It will prolong. Why it will prolong? Because you are giving the blockers of potassium channel, and potassium helps in the repolarization. So you will get this like this. So it's this prolongations, this will be called action potential durations, APD. Action potential durations will be increased. If you are putting the patients on sodium channel blockers along with potassium channel blockers, then what will happen? Your action potential durations will increase, right? So how it increase? Because first is when you are giving the sodium channel blockers, so this phase 0 slope is going to decrease, right? So this is effect we will study. One by one we are going to discuss about class 1 agents, that is the sodium channel blockers in arrhythmia. So class 1 agents, as I said, class 1 agents in anti-arrhythmic agents. So these are classified further into 3 types: class 1A, 1B and 1C. एंड क्लास 1 एजेंट्स कौन से एजेंट्स हैं? जो सोडियम चैनल को ब्लॉक करते हैं, सोडियम चैनल ब्लॉकर. व्हाट डज इट मीन? इट मीन्स दीज ऑल ड्रग्स, वेदर इट इज क्लास 1A, 1B, 1C, these all will block the sodium channel, right? Because they comes under sodium channel blocker, right? So they will block the sodium channel. Sodium channel blockers, all are sodium channel blockers. What their classification is depending upon the effect on the potassium channels. So we are classifying these agents based on effect on the potassium channel. So what does it mean? It means these 1A have a different effect on the potassium channel, B have a different effect, C have a different effect, but all A, B, C all block the sodium channel because they comes under class 1 agent, and class 1 agents in anti-arrhythmic classification are those drugs which block the sodium channel. So what is the effect on potassium channel? When we talk about class 1A agents, these will potassium channel blockers. So what does it mean? It means these drugs, what it do? It block the sodium channel as well as the potassium channel, right? Class 1B, these are the drugs which will open the potassium channel opener. They are sodium channel blocker, they are also sodium channel blocker, but they are going to open the potassium channel. Class 1C, these are the drugs which have no effect on the potassium channels. So that means these are the drugs which is only going to block the sodium channel. They don't have effect on the potassium channel. So based on these blocking properties, we are classifying the class 1A agents in anti-arrhythmic drugs based on their effect on potassium channel. Again I am repeating, क्लास 1 आपको मैंने बताया 5 क्लासिफिकेशन है एंटी एरिथमिक एजेंट में. क्लास 1 ड्रग्स जो कि सोडियम चैनल को ब्लॉक करती हैं, क्लास 2 ड्रग्स वो हैं जो बीटा ब्लॉकर हैं, क्लास 3 वो ड्रग्स हैं जो पोटासियम चैनल को ब्लॉक करती हैं, क्लास 4 वो ड्रग्स हैं जो कैल्शियम चैनल को ब्लॉक करती हैं, और क्लास 5 वो ड्रग हैं जो इन चारों में से किसी मैकेनिज्म में नहीं आती, कोई अलग मैकेनिज्म से काम करती हैं, दैट इज बी कॉल्ड मिसलेनियस एजेंट्स. तो हम अब स्टडी कर रहे हैं क्लास 1 एजेंट्स में. फिर फर्दर 3 क्लासिफिकेशन है, क्लास 1A, 1B, 1C. तो तीनों 1A, 1B, 1C तीनों जो ड्रग्स आएंगी इस कैटेगरी में, दे ऑल आर सोडियम चैनल ब्लॉकर, बट वी आर डूइंग द क्लासिफिकेशन बेस्ड ऑन द इफेक्ट ऑन द पोटासियम चैनल. तो पोटासियम चैनल पे इफेक्ट क्या है? क्लास 1 ड्रग्स वो ड्रग हैं जो सोडियम चैनल को ब्लॉक करने के साथ पोटासियम चैनल को भी ब्लॉक करती हैं. क्लास 1B वो ड्रग हैं जो सोडियम चैनल को ब्लॉक करने के साथ पोटासियम चैनल को ओपन करती हैं, ब्लॉक नहीं कर रही है पोटासियम को, सोडियम ब्लॉक कर रही है पर पोटासियम को ओपन कर रही हैं. क्लास 1C वो ड्रग हैं जिनका कोई इफेक्ट नहीं है पोटासियम चैनल पे. So these are the 3 types of drugs under class 1A agents. So we are going to discuss the drugs under class 1 agents. There is a drug is quinidine and procanamide. these are the drugs which comes under class 1 agents. So right, so what will be the effect of class 1 agents on action potential durations if we talk about, right? So this is your normals, right? 0, 1, 2, 3. So when you are giving class 1 agent to the patient, so what will happens? You know, if you are giving class 1 drugs to the patients, so this slope for all the drugs, all these 3 category of drugs, this slope is going to decrease because all are sodium channel blocker. सारे तीनों ड्रग्स 1A, 1B, 1C तीनों सोडियम चैनल को ब्लॉक कर रही हैं, राइट? तो और मैंने आपको बताया जो ड्रग सोडियम चैनल को ब्लॉक करेंगी वो क्या करेंगी, इस फेस 0 की स्लोप को डिक्रीज करेंगी, राइट? सो सोडियम चैनल्स, क्योंकि ये फेस 0 कब बन रहा है, जब आपका सोडियम चैनल ओपन होता है। जब आप सोडियम चैनल को ब्लॉक कर दोगे तो स्लोप ऐसे है तो ये ऐसे टिल्ट कर जाएगी, दैट इज बी कॉल्ड डिक्रीज इन द स्लोप ऑफ फेस 0। कई बार एमसीक्यू में क्वेश्चन आता है विच ड्रग्स इज गोइंग टू डिक्रीज द फेस 0, आपके पास ये सारी ऑप्शन दे देंगे, लास्ट में एक और लाइन दे देंगे डी ऑल ऑफ द अबव। सो इन दैट केस इफ अगर यहाँ से भी एक ड्रग दी है, यहाँ से एक ड्रग दी है, यहाँ से एक ड्रग दी है और आपका एमसीक्यू है विच ऑफ द फॉलोइंग ड्रग इज गोइंग टू डिक्रीज द स्लोप ऑफ फेस 0 एंड एक ऑप्शन दिया ऑल ऑफ द अबव, द आंसर टू दैट क्वेश्चन विल बी द ऑल ऑफ द अबव। क्यों? क्योंकि ऑल आर दी सोडियम चैनल ब्लॉकर और जितने भी सोडियम चैनल ब्लॉकर हैं दे आर गोइंग टू डिक्रीज द स्लोप ऑफ फेस 0। और क्यों डिक्रीज कर रही है वो भी मैंने आपको बता दिया, क्योंकि सोडियम चैनल फेस 0 कब बन रहा है, जब आपका सोडियम चैनल ओपन हो रहा है। जब आप ब्लॉक कर दोगे उसको, ऐसे जा रही है स्लोप, जब आप ब्लॉक कर दोगे तो वो डिक्रीज कर जाएगा, राइट? सो दैट इज, ये तो आपको इफेक्ट रहेगा फेस इसमें 1A में। डिफरेंस कहाँ पे आएगा, बिकॉज दे आर डिफरेंट एक्शन ऑन पोटेशियम चैनल, सो ड्यू टू डिफरेंट एक्शन ऑन पोटेशियम चैनल दे हैव ए डिफरेंट इफेक्ट। तो अगर जो ड्रग्स सोडियम चैनल के साथ साथ पोटेशियम को भी ब्लॉक कर रही हैं तो वो ये क्या कैसे आएगा, इसका ये ऐसे आएगा, इस साइड ये शिफ्ट होगा, क्योंकि पोटेशियम इज रिस्पॉन्सिबल फॉर रीपोलराइजेशन, राइट? और पोटेशियम को क्या कर दिया आपने, ब्लॉक कर दिया। पोटेशियम ब्लॉक कर दिया तो रीपोलराइजेशन होने में टाइम लगेगा ज़्यादा, तो आपका ही शिफ्ट ऐसे हो गया। तो अल्टीमेटली जो एक्शन पोटेंशियल ड्यूरेशन है वो बढ़ गया, राइट? सो क्लास 1A ड्रग्स could result in QT prolongations। मैंने आपको बताया था QT prolongations क्या है। ओके, ये आपका ECG है, PQRST। तो QRS ये है QT इंटरवल, यहाँ से लेके यहाँ तक। QT इंटरवल क्या रिप्रेजेंट कर रहा है? QT इंटरवल इज रिप्रेजेंटिंग ventricular depolarizations and ventricular repolarizations. This one is representing ventricle depolarizations and this one is representing ventricle repolarizations. इस साइड पोटेशियम, इस साइड सोडियम, राइट? तो ये ड्रग्स क्या करेंगे, द ड्रग्स विच कम्स अंडर क्लास 1A एजेंट्स लाइक क्यूनिडीन एंड प्रोसिनामाइड, दे विल इंक्रीज द QT इंटरवल। और क्यों इंक्रीज कर रही हैं, यू नो द रीजन, क्योंकि सोडियम को भी वो ब्लॉक कर रही हैं और इधर आपके पोटेशियम को भी ब्लॉक कर रही हैं, तो एक्शन पोटेंशियल ड्यूरेशन बढ़ जाएगा और आपका QT विल बी प्रोलॉन्ग। You know, if you go through the internet, you will find that there are many drugs which are withdrawn from the market due to QT prolongations. मार्केट में वो पहले लॉन्च हो गई, फिर वो विड्रॉ करनी पड़ी क्योंकि वो QT को प्रोलॉन्ग कर रही हैं। So these are the drugs, quinidine and prokinamide under class 1A agent. Quinidine, if you see, quinidine under class 1A agents, we discuss one by one class 1A agents or class 1A drugs. So there is a quinidine. Quinidine is obtained from cinchona plants. Cinchona. It's derivative from the cinchona. एक आपने और नाम सुना होगा क्यूनिन. Quinine is your anti-malarial drug. This one is your anti-malarial. This is also obtained from cinchona. Anti-malarial drug. Anti-malarial drug, right? Quinine is also anti-malarial drug, but when you are writing anti-arrhythmic drug, तो आपको ये ध्यान रखना है क्यूनिन नहीं लिखना है वहाँ पे आप लिखना है क्यूनिडीन, नॉट क्यूनिन। Quinine is your anti-malarial drug. Quinidine have some effect on malaria as well, but not powerful anti-malarial agent. Anti-malarial agent is quinine, not the quinidine. Quinidine comes under anti-arrhythmic agents, right? So this is obtained from cinchona. I hope it's clear. So, but of course, if this could result in synchronism, if you are giving it high doses, adverse effect is nausea, vomiting, diarrhea, visual disturbances हो जाएंगे, mental disturbances, so that we call synchronism if you are using it at high dose, right? So this is about class 1 agent quinidine, and next drug under this one is procanamide, right? Procanamide. This is the derivative of procaine. Procaine is your anesthetic, right? Procanamide, and this is also a sodium channel blocker. But class 1 agents, it's also going to block the potassium channel. Procanamide, this is a drug which is going to metabolized by acetylations in the liver. Acetylations. So by acetylations, this will be converted. Procanamide will be converted into N-acetyl procanamide. N-acetyl procanamide, right? You might heard about one concept with respect to pharmacology is there are some population which are slow acetylators and there are some population which are fast acetylator. You might heard about with respect to INH, isoniazid, that is the anti-tubercular drugs, right? So in case of procanamide also, there can be a slow acetylator, there can be a fast acetylator. So what does it mean? It means that there is some populations which is going to acetylate this procanamide faster. There is some populations which is going to acetylate this procanamide little bit slower. So the population which is going to acetylate the procanamide slower, that we call slow acetylator. That population is slow acetylator. And the population which is going to fast, that is we call fast acetylator, right? So what does it mean? There is a population with respect to procanamide. This is the second drug which we are studying, and it's a derivatives from the procaine. Procaine is your anesthetic. So this procanamide, when it enters in liver, there is a, by the process of acetylations, this procanamide is going to convert into N-acetyl procanamide. N-acetyl procanamide. And this is your effective, right? So there is a, as I said, this acetylations by happening by the liver enzymes. So there is a some populations which are fast acetylators. Fast acetylators, that means in that population if you are giving this procanamide, they will metabolize it faster, they will acetylate it faster. And there is a some populations which are slow acetylators. Slow acetylators. So what happens if the population, if you are giving the procanamide to the fast acetylators, it will metabolize faster, right? If you are giving it to slow acetylators, it will metabolize slowly and it can accumulate in the body as well, right? So in these, particularly in the slow acetylators, procanamide could result in DLE, drug induce, you might heard about lupus erythromatous. Drug induced lupus erythromatous. ये क्या होता है? This is a autoimmune disease. Autoimmune disease means your immune system is not able to recognize your own body cells and start killing it, right? Your immune, we discuss in immune systems lecture as well. First thing is your immune system should have the ability to differentiate between the self and non-self. So what happens in autoimmune disease? In autoimmune disease, your immune system is not able to differentiate between the self and non-self. So that is happening in this case. What happens? Slow acetylators, it will be metabolized slowly, and if these procanamide is going to accumulate in the body, so it's going to bind with the host proteins, right? And it makes the complex, and that complex immune system will recognize it as a non-self. Immune system will thought it's a non-self and start killing this, and it will produce inflammations everywhere in the body. Inflammation in liver, inflammation in kidney, inflammation in heart, systemic inflammation everywhere. So that's why drug induced lupus erythromatous is dangerous, right? So that is your about the procanamide. and procainamide comes under class 1A agents. So under class 1A agents, what we have discussed so far? One drug we have discussed, quinidine, that is obtained from cinchona, and another is procainamide. With respect to quinidine, we have discussed if you are giving at high doses of the quinidine, it could result in synchronism, and in synchronism patients will feel nausea, vomiting, diarrhea, visual disturbances, mental disturbances everywhere, right? So we have to use these drugs carefully, and both drugs could result in QT prolongations. QT prolongations, it can prolong the QT intervals, right? So this is about the class 1A agents. So next one is your class 1B. So if you remember, class 1A वो agents है which is going to inhibit sodium channel as well as the potassium channel. Class 1B are those agents which is going to block the sodium channel, सोडियम को ब्लॉक कर रहे हैं और पोटासियम को क्या कर रहे हैं, ओपन, पोटासियम को ओपन कर रहे हैं. और क्लास 1 ने क्या कर रहे थे, सोडियम को ब्लॉक कर रहे थे, पोटासियम को भी ब्लॉक कर रहे थे, राइट. सो इन क्लास 1B एजेंट्स द ड्रग्स अंडर दिस कैटेगरी इज लिग्नोकेन, this is your anesthetic, right, local anesthetic, well known local anesthetic, lignocaine, right. Phenytoin, this is another drug well known, this is the anti-epileptic drug phenytoin, this is sodium channel blockers, right, but it's going to open the potassium channel as well. So lignocaine and phenytoin, there is a derivative of lignocaine, there is another drug is also there, maxilitine, T-I-N-E, maxilitine is the derivative of your lignocaine, right. So phenytoin, lignocaine, maxilitine. So what these drugs do, these drugs blocks the sodium channels. So your phase 0 is going to, this is your normal 0, 1, 2, 3. So phase 0 will going to, slope of the phase 0 is going to decrease, right, that is happen. But what happens to the phase 3, because your potassium channel is open, so it will goes like this side, got it, it will be decreased. So in this case action potential duration is decrease or increase, action potential duration is going to decrease, you can see that, right, that is the difference, you know, these drugs not going to result in your QT prolongations. So why it's happening, because sodium channel, when you are blocking the sodium channel, your slope of phase 0 is going to decrease, that's happening with all the agents, but these are the potassium channel opener. If we are giving class 1 agent, so in class 1 agent what's happening, this is same, right, what this phase you are getting like this, right, this is the class 1A agents. Class 1A agents are those agents which block the potassium channel. Potassium channel block हुआ तो it will be goes like this, right, it will take much more time for the repolarization. When you have given such kind of drug which is blocking the sodium channels but opening the potassium channel, अगर आपका potassium channel open हो रहा है तो repolarization जल्दी होगी तो this will goes this like, and your action potential duration is going to decrease, right. So this is about your class 1B agents, lignocaine, maxilitine, phenytoins, and then class 1C. Class 1C are those agents which is going to block of course sodium channels, but they have no effect on the potassium channels. No effect means na block karega na open karega, that is meaning of no effect, right, that is the class 1C. Among this procainamide is the one of the drugs, procainamide, right, procainamide, there is a flecainide, and there is a one phenomena that we call Wolff-Parkinson White syndrome, Wolff-Parkinson's White syndrome, WPW, Wolff-Parkinson White syndrome. So in that cases we are giving the drug flecainide, and that is comes under class 1C agent. So what is Wolff-Parkinson White syndrome? Wolff-Parkinson White syndrome is the, you know, when your rhythms becomes irregular. Irregular means it particularly results in tachycardia, and it's due to birth defect. कि जन्म से ही आपका प्रॉब्लम आ गई कि आपका टैकीकार्डिया हो रहा है, राइट, दैट इज द वॉल्फ पार्किंसन वाइट सिंड्रोम. दिस इज द कंजाइनल, दिस इज कंजाइनल मीन्स birth defects. So due to birth defects, what's happening? Tachycardia, right? So you want to slow down, right? So you are giving the such kind of drug which is sodium channel blocker. So flecainide is a drug, but I am not saying drug of choice, because there are other ways to treat this Wolff Parkinson White syndrome apart from drugs. But yes, this is the drug which is being used in the Wolff Parkinson White syndrome. And what is the Wolff Parkinson White syndrome? It's a birth defect in which your rhythm is too high, and that we call tachycardia, means there is tachycardia due to birth defects, right? So these are the drugs which comes under class 1C agents. So what we have discussed so far, we are discussing about anti-arrhythmic agents quickly. Anti-arrhythmic agents, and in anti-arrhythmic agents we are discussing about class 1A drugs, class 1 drugs, and class 1 are those drugs which is going to block sodium channels, right? But they are further classified into 3 types based on their effect on potassium channel. So class 1A are those drugs which are potassium channel blocker, along with sodium channel. Class 1B are those drugs which is going to open the potassium channels. These are going to block. And class 1C are those agents which have no effect on the potassium channels, right? So there is no effect. So you know, in class 1A when you are giving it, there is a little bit deep, then this 0 1 2 3. When talk about class 1A, all classes 1A, 1B, 1C, in all classes your slope of phase 0 will decrease in all, right? But there is a effect on the potassium channels. This is the potassium channel, right? If you are giving class 1 agents, because potassium channel is also closed, so this action potential duration will increase. It goes like this. This is the class 1A, right? If we talk about class 1B, because potassium channel is open, slope is same, but it's going to shift this side. This is a class 1B. And what is a class 1C? There is no effect on this side, phase 3. Phase 3 will be same. Only effect, because there is no effect on the potassium channel, तो phase 3 पे तो कोई effect ही नहीं रहेगा, वो तो same ही जैसे normal आ रहा है वैसे ही आएगा. Only effect जो phase 0 पे आ रहा है, जिसकी slope decrease हो रही है, वो तो तीनों में ही होगी. क्यों हो रही है? क्योंकि sodium channel block हो रहे हैं. This is about class 1 drugs. Now class 2 drugs. Anti-arrhythmic agents, class 2 drugs. And class 2 drugs we have discussed many times. These are the beta blockers, like esmolol, propranolol, propranolol. These are the drugs which lol is there. So beta blockers. Now question is, beta blocker कहाँ use करोगे? Where you will use the beta blocker? When there is a tachyarrhythmia or bradyarrhythmia? When there is a tachyarrhythmia. So whether it is atrial tachyarrhythmia or ventricular tachyarrhythmia, you can use the beta blockers, right? Because beta blockers are those agents which will block beta 1 receptors. And if you remember, I told you earlier as well, beta 1 receptors are everywhere on the heart, right? In atria, in ventricle, there is a beta 1 receptors, and beta 1 receptor stimulation result in tachycardia, right? If you are blocking it, so it will helps in the tachyarrhythmia, whether it is atrial tachyarrhythmia or ventricular tachyarrhythmia. These are your class 2 drugs. We are not going to discuss more detail, because already we have covered many times how beta blockers works, right? So similar mechanism, beta blocker GPCR, it will block it, then your CMP will not increase, so it will slow down the heart. Now class 3 drugs are those drugs, class 3 drugs in class 3 drugs, So class 3 drugs which are the potassium channel blockers, which blocks the potassium channels. So drugs under this classification is, well known drug is amiodarone, right? Amiodarone is the drug which particularly not blocking only the potassium channel, which also blocking sodium channels, this have effect on potassium, its effect on calcium as well. With all the mechanism, this amiodarone is showing the anti-arrhythmic actions, but mainly it's showing the potassium channel blocking activity, right? Amiodarone. There is another drug, bretilum. But with respect to amiodarone, these drugs, because it blocking the potassium channels, so your QT interval will be prolonged, right? So this phase will become more, this durations will increase much more, action potential durations. So that means QT prolongations can happen with the amiodarone. But amiodarone is not a safe drug. It could result in various toxicity as well. It could result in hypothyroidism and hyperthyroidism as well. So how you can remember it? अगर आप इसी spelling सही से देखो, amiodarone, so there is a ido, right? Ido word is also there, and ido represent iodine, and iodine represent your hyperthyroidism or hypothyroidism. So both can be happen. So with the spelling you can remember it. Amiodarone means it could result in hyperthyroidism or hypothyroidism as well. It could result in it's a photosensitive as well, right? It could result in hepatotoxicity as well, right? So these amiodarones have various toxicity as well, so you have to use it carefully. And and there is a bretilum. Bretilum is another drug which is being used, and this is the potassium channel blocker, but it prolongs the QT intervals, right? Then there is a class 4 agents. Many times we have discussed in cardiovascular pharmacology class 4 agents, and these are the drugs which is going to block calcium channels. And which calcium channels are present on the cardiovascular systems? L or T types? There is a L and T type. So which one? L type. L type. Sometimes you can face the objective question. They will give the options. Okay, for cardiovascular pharmacology, which type of the channel? So there is a L type calcium channel are present on cardiovascular system. L type calcium channels, it's going to block. And if you remember, we have discussed about verapamil, diltiazem. We have discussed about dihydropyridine, and drugs under that case is nifedipine, amlodipine, the drugs which end with the dipine, amlodipine, right? So you have to use those calcium channel blockers which have effect on cardiovascular, because these are the classification based on, because if you remember in earlier video we have discussed their calcium channel is not only present on heart, this also present on your arterial smooth muscles, it's also present on venous smooth muscles. So there are drugs which is particularly some calcium channel blockers are going to block your arterial smooth muscles calcium channel more as compared to heart. Some will be more act on the heart as compared to arteries or veins, right? So depending upon the requirements, we have to use them, right? So particularly we want L type which are present on your heart, because heart is with respect to arrhythmia is from the heart, not with respect to your arteries or veins, right? So that we have discussed in detail which one is more selective and which one is going to block more selective for the calcium channel which are present on heart, and which one is for the arteries, right? Then class 5 is those drugs which not comes under above classification. The drugs under this category is digoxin, which this we have discussed many times. And if you remember, I told you digoxin is a very good drug when we talk about atrial fibrillations, left ventricular failure with atrial fibrillation. Digoxin is very good drug with atrial fibrillations. So I told you why digoxin is very good drug in such kind of, because atrial fibrillation is also your arrhythmia, right? Your heart conduction is too fast in the atria, and you don't want these atrial conductions will go to the ventricle, otherwise your ventricle will also not work properly, right? So we have discussed in detail, and that is due to its indirect actions on the vagal tone, right? Digoxin's indirect actions on the vagus nerves, vagal tone, it stimulates the vagus nerve. So due to that, atrial depolarization, here is too much conductions in the atria, too much width, right? So you don't want this conduction should go to the ventricle. If it goes to the ventricle, your ventricle will not work and patients can collapse, right? So digoxins is the drug which will inhibit this AV node, and due to that this conduction will not goes to the ventricle. So this is the miscellaneous drugs, not comes under sodium channel blocker, not comes under potassium channel blockers, calcium channel blocker. There is another drugs which we are using under miscellaneous is atropine. Atropine is your anticholinergic drug. Atropine is your anticholinergic drugs. So if you remember, what the cholinergic system do with the heart? Cholinergic system is going to slow down your heart. Why? Because in cholinergic system there is acetylcholine. Acetylcholine have a receptors all over the heart is muscarinic, not all over the heart but all over the body is muscarinic and nicotinic receptors. Muscarinic receptors are further categorized into M1, M2, M3, right? And nicotinic receptors are two types, NN and NM. Muscarinic, these all muscarinic receptors are GPCR, G protein coupled receptors, and these nicotinic receptors are your ligand gated ion channel receptors. Okay, I can discuss it. Atropine, when we talk about atropine as anti-arrhythmic agents, so first you have to understand, because it's an anticholinergic drug. So as I told you, acetylcholine have a two types of receptor where it acts, muscarinic and nicotinic, right? Muscarinic receptors are further categorized into M1, M2, M3. There is M4, M5 as well, but their role is not cleared. There is NN and NM. These all are GPCR, right? And these are your ligand gated ion channel receptors. Ligand gated ion channel receptors, right? So what happens when your acetylcholine on the heart, there are M2 receptors. We are talking about this one only. So acetylcholine when act on M2 receptor which are present on heart, so you know GPCR, there is a GS, GQ, GI form of G protein. So it's going to inhibit this GI. It's going to activate GI and GI is going to inhibit your heart. So when acetylcholine act on the heart, it's going to result bradycardia, right? But we are talking about atropine. Atropine is your anticholinergic drugs, means it's going to block the action of acetylcholine. So if it's going to block the action of acetylcholine, so in which conditions it's going we can use the acetylcholine? Because if you are going to block this, so what will happen? Your tachycardia will happen, right? So this is the drug which you can use in the conditions of bradyarrhythmia. ब्रेडीअरिथमिया मीन्स आपकी रिदम नॉर्मल रिदम से कम हो रही है, उसको हम ब्रेडीअरिथमिया बोलते हैं. तो एट्रोपिन ऐसी दवाई है जो ब्रेडीअरिथमिया में यूजफुल हो सकती है. कैसे हो सकती है? क्योंकि नॉर्मली एसिटाइलकोलिन जो है वो आपका स्लो डाउन करता है हार्ट को, पर आपने क्या किया, ऐसी दवा जब आप इसको ब्लॉक कर रहे हो तो आपकी हार्ट रेट थोड़ा, और ब्रेडीअरिथमिया में आप ऐसी दवाई देना चाहोगे जो आपकी हार्ट रेट को इंक्रीज करे, right? So that is the atropine. So atropine we are using. Another drug is, we have already discussed in detail, adenosine. If you remember, adenosine is also used as anti-arrhythmic agents. Adenosine very short half life, आपको इंजेक्शन के थ्रू देनी पड़ती है, और इंजेक्शन भी आपको जुगुलर वेन्स वगैरह में देना पड़ता है प्रेस करके. Adenosine, otherwise it will be destroyed immediately. So adenosine, if you remember, we have discussed this adenosine drugs when we talk about the drugs which can increase the PR intervals. If you remember, calcium channel blocker, digoxins, right? In that lecture we have discussed about adenosine. So adenosine is another drugs which we are using as a anti-arrhythmic agent. So this is all about anti-arrhythmic agents, anti-arrhythmic drugs, right? So quickly overlap anti-arrhythmic drugs. क्या क्या हमने अब तक पढ़ा? This all about anti-arrhythmic drugs. हमने पढ़ा पहले क्लास 1. कितनी क्लासेस हैं? क्लास 1, क्लास 2, क्लास 3, क्लास 4 एंड क्लास 5. 5 तरह की क्लासेस हैं. क्लास 1 जो है वो फर्दर डिवाइडेड हैं क्लास 1A, 1B, 1C. बट क्लास 1 जो जितनी भी ड्रग्स हैं ये क्या हैं? सोडियम चैनल ब्लॉकर, सोडियम चैनल को ब्लॉक करेंगे. पर आगे वाली क्लासिफिकेशन है इनका इफेक्ट पोटासियम चैनल पे। तो क्लास 1 में वो दवाइयाँ हैं जो पोटासियम चैनल को भी ब्लॉक करती हैं, क्लास 1 भी वो दवाइयाँ जो पोटासियम चैनल को ओपन करती हैं, क्लास 1 सी वो दवाइयाँ हैं जो पोटासियम चैनल पे कोई इफेक्ट नहीं है, नो इफेक्ट ऑन पोटासियम चैनल हैं, ये सारी सोडियम चैनल ब्लॉकर ही हैं। क्लास 2 है वो ड्रग्स हैं जो बीटा रिसेप्टर को ब्लॉक करेंगी, बीटा ब्लॉकर्स। क्लास 3 वो दवाइयाँ हैं जो आपके पोटासियम चैनल को ब्लॉक करेंगी, पोटासियम चैनल ब्लॉकर। क्लास 4 वो ड्रग है जो कैल्शियम चैनल को ब्लॉक करेंगे, कैल्शियम चैनल ब्लॉकर। और क्लास 5 वो ड्रग हैं जो मिसलेनियस हैं, जो इन किसी भी मैकेनिज्म में नहीं आते। ये क्लासिफिकेशन है आपकी एंटी एरिथमिक की। अब ड्रग्स की बात करें तो क्लास 1 में अगर आप कोई ध्यान आया हो, क्यूनिडीन एक ड्रग है जो क्लास 1A है, प्रोकेनामाइड एक ड्रग है, राइट। क्लास 1B में आपकी लिग्नोकेन है, लिग्नोकेन, राइट, फेनिटोइन, मैक्सिलिटीन, मैक्सिलिटीन 3, ठीक है। क्लास 1C में आपकी प्रोपाफिनोन, राइट। बीटा ब्लॉकर हमने बहुत बार पढ़ लिए हैं, जिसमें आपके बीटा ब्लॉकर्स में आपके इस्मोलोल, प्रोपेनोलोल, राइट। पोटासियम चैनल ब्लॉकर में हमने पढ़ा एमियोडेरोन, एमियोडेरोन, राइट, ब्रीटाइलम, ब्रीटाइलम, डॉफिटिलाइड, डॉफिटिलाइड, ये सारी दवाइयाँ आपकी क्लास 3 में। कैल्शियम चैनल ब्लॉकर हमने कई बार पढ़ लिए, वेरापामिल, डिल्टीएजम एंड डाईहाइड्रोपिरिडिन में निफिडिपिन, एम्लोडिपिन। मिसलेनियस में हमने जो दवाइयाँ पढ़ी, डिगॉक्सिन, एट्रोपिन एंड एडिनोसिन। मैग्नीशियम भी यूज़ करते हैं, एडिनोसिन, मैग्नीशियम इज एज वेल। So this is about your these one drugs which are being used as anti-arrhythmic agents, and these are the drugs. There is a propafenone, there is a flecainide. Flecainide का हमने बताया, they are useful in Wolff Parkinson White syndrome. Wolff Parkinson, sometime MCQ में क्वेश्चन आता है कि कौन सी anti-arrhythmic drug is useful in the Wolff Parkinson White syndrome? Flecainide, right? So these all are about your anti-arrhythmic drugs. Thank you.